Next in the course, you will learn about the golden hour immediately after birth. By the end of this lecture, you should be able to verbalize the importance of the golden hour, the benefits of skin-to-skin contact, the importance of delaying any non-essential interventions, and lastly, you should be able to verbalize safety considerations to keep in mind during the golden hour. As midwives, understanding the research done regarding the golden hour will help you better implement holistic care, which helps the baby stabilize after birth and prepares them for the best transition into the extrauterine life as possible. Interventions in the golden hour has shown to have much more success, such as the initiation of breastfeeding, as breastfeeding during this golden hour has shown to improve success rates. It is in the golden hour that you as the midwife will have the ability to predict how babies are adapting to their new environment. Skin-to-skin is encouraged during this hour, which helps to regulate their temperature, breathing, and heart rate. This lecture will reinforce communications, evidence-based protocols, and procedures, and will assist you in standardizing elements of care within that golden hour, which will hopefully improve outcomes for mom and baby. The golden hour is defined as the first hour of postnatal life in both preterm and term neonates. It is one of the most important and crucial hours during a baby's transition from the womb to the outside world. During this golden hour, there is a period of time in which the baby and mother are left undisturbed so that they can help bond and reap the benefits of immediate skin-to-skin contact. Skin-to-skin contact is referred to as the practice where a baby is dried and placed directly on the mother's chest after birth. Both the woman and newborn is covered in a warm blanket and left for at least an hour or until after the first feed. In more intensive neonatal units, this practice is often referred to as kangaroo care. Skin-to-skin helps parents bond with their babies and supports better physical and developmental outcomes for baby. Let's discuss some of the many benefits of skin-to-skin, beginning with improvement in heart and lung function. Newborns that are placed skin-to-skin with parents appear to adapt sooner to extrauterine world than those who are not. Those babies tend to have heart and breathing rates that are both more stable and falls within a normal range. The sounds of the mother's heart thumps and breathing patterns are familiar to the baby and poses as a potential calming mechanism for the baby. During pregnancy, a mother maintains her baby's temperature by sweating when hot, shivering, and moving when cold. After birth, babies have yet to acquire the same ability, so they can't adjust their own body temperature. When it comes to keeping a vulnerable newborn warm, a mother's body is better at warming the baby and maintaining thermal regulation than that of an artificial warmer. Like adults, babies use blood sugar for energy. Before birth, they get glucose through the placenta. After birth, they get it from their mother's milk. If the baby's glucose needs exceeds what he can get from his mother's milk or from his liver, he will experience low blood sugar. This can cause him to feed poorly, which can exacerbate the problem. The risk of low blood sugar is higher for babies born to mothers with gestational diabetes due to higher insulin levels in their blood. In relation to glucose control, skin-to-skin care in the hour immediately after birth has shown to help stabilize the baby's blood sugar levels. Skin-to-skin promotes breastfeeding by helping babies to activate their natural instincts, which can help him locate, latch on, and breastfeed. The role of vaginal birth versus cesarean birth in transferring good bacteria from mother to her newborn can't be overstated. Passage through the birth canal allows the baby gut to be colonized with the bacteria from the mother's vagina. Another way the baby gets exposed to the mother's bacteria is through skin-to-skin contact after birth. Bacteria in the vagina and on the skin are different from bacteria found in a hospital isolate, so early exposure helps babies develop a healthy range of bacteria. Skin-to-skin contact also supports early breastfeeding. Some of the complex sugars in human milk are indigestible in the newborn, but are the perfect food for a subspecies of bacteria that A. coats intestinal walls, B. boosts digestive function, and C. provides protection from other harmful bacteria or pathogens. Experts believe that good bacteria may protect against allergic disease. It may even help to decolonize infants in the NICU who have Staph aureus in their nostrils. Babies who are held skin to skin, particularly by their mother, are apt to cry less, especially less than those separated from their mothers. Some refer to newborns' cry as separation distress call, noting that it is a mammal-like reflex well suited to calling the mother back to the young. During the newborn period, most babies cease crying once reunited with their mothers. It's also understandable that a baby is less likely to cry when he feels the protection and security provided by his mother. Having the baby room in with the mother at the hospital can help ensure that she is able to respond to her baby's needs and provide frequent skin-to-skin contact. Rooming in is a simple way to describe keeping the baby in the room, same room with mom or caretakers, as opposed to having them cared for in the NICU or in a different room other than mom. Babies experience less pain when held skin to skin during or immediately following a procedure, and that duration of pain is shortened by the close contact. Skin to skin is also shown to be more beneficial than oral glucose or sugar water, a traditional solution in relieving pain during a Hill stick for blood sampling. Skin-to-skin care provides better relief of pain symptoms the longer the skin-to-skin care is implemented. Time after a baby's birth provides an opportunity for parents to also learn about their baby's behaviors. Parents will be more in tune with the baby's signs of hunger, signs of fullness, signs of discomfort, etc. Having the baby in close skin-to-skin contact helps to ensure that the mother will learn her baby's signals sooner, improving communication and boosting maternal confidence, as well as helping babies develop a sense of trust and security. Babies who are held skin to skin are thought to be more stable physiologically than their peers who are placed in a warmer after birth. They also demonstrate better neurobehavioral outcomes, as indicated by many of the factors that have been noted, including less crying, lower pain response, and improved breastfeeding outcomes. When mothers and babies are separated after birth, there are few opportunities to get to know each other. Touch is essential, and skin-to-skin contact enables mothers and babies to use all of their senses in nurturing this new and vital relationship. Studies show that skin-to-skin care boosts health well beyond the newborn's first days of life. There are 9 instinctive behaviors during skin-to-skin care after birth exhibited by the newborn. 1. The birth cry. which occurs after birth as newborn's lungs begin to expand. 2. During relaxation. The baby exhibits relaxed hands without movements of the mouth. 3. The awakening behavior, which is when the newborn exhibits small movements of the head and shoulders. 4. Activity or mouthing, suckling, rooting. 5. Then there's the resting period, or periods of rest between any of the stages. 6. Crawling, when the newborn approaches the breast with short periods of action, reaching the breast and nipple. 7. Familiarization. With this behavior, the newborn licks the nipple, touches and massages the breast. The 8th instinctive behavior is suckling, where the newborn attaches and suckles at the breast. And lastly, sleep. The newborn falls into restful sleep. There are times when it is appropriate to delay non-essential interventions, beginning with bathing. Delaying bathing for at least 8 hours after birth protects the newborn skin from bacterial invasion, helps keep the skin conditioned, maintains their blood sugar and temperature regulation. Delaying bath also encourages the establishment of breastfeeding, along with the bonding that mothers get, which being skin to skin with their newborn promotes. Initial newborn assessments can be done after skin to skin and nursing has occurred. Frequent, focused assessments can also be done when the baby is on the mother's chest, like the heart, lungs, temperature, chest color, alertness, and muscle tone. All are assessments that can be done when the baby is skin to skin. Vigilance of the baby's well-being is a fundamental part of postnatal care immediately following and in the first few hours after birth. For this reason, normal observations of the baby's temperature, breathing, color, tone, all should continue throughout the period of skin to skin, in the same way as it would occur if the baby were in an isolate. Care should always be given to ensure that the baby is kept warm. Providers should have a conversation with the mother and her companion about the importance of recognizing changes in the baby's color or tone and the need to alert staff immediately if they are concerned. Basically, you should be having educational discussions about normal newborn transitional signs versus areas of concern with the caretakers, informing them of when to alert the midwife or practitioner. Observations should be made of the mother to ensure skin to skin is being utilized. Also, keeping an eye out for changes in conditions that will require prompt removal of that baby. Also, keeping a lookout to ensure that the baby cannot fall or become trapped in bedding or by the mother's body. Mothers should be encouraged to be in a semi-recumbent position to hold and feed their baby. Particular care should be taken within this position, ensuring the head is supported so the infant's airway does not become obstructed. A few additional things to consider regarding the mother during that golden hour. Mothers may be very tired following birth and may need constant support and supervision. Mothers may continue to hold the babies in skin-to-skin contact during perineal suturing, provided they have adequate pain relief. However, a mother who is in pain may not be able to hold her baby safely. Finally, babies should not be skin-to-skin with moms when they are receiving analgesics that may impact their consciousness. Check in the baby's positioning to ensure that the airway is maintained, observing the respiratory rate and watching for chest movement. Listen for unusual breathing sounds or absence of noise from the baby. The baby's color should be assessed by looking at the whole of the baby's body, as the limbs can often be discolored at first. Subtle changes in the color indicate changes in the baby's condition. When assessing tone, the baby should have a good tone and not be limp or unresponsive. And lastly, the temperature. Ensure the baby is kept warm during skin-to-skin contact. In conclusion, every moment between a mother and her newborn baby is important. For successful breastfeeding, the first hour after birth is arguably the most important. The golden hour is a very important part of the transition from intrauterine life to extrauterine life, and it helps the baby to stabilize and prepares it for the best possible transition. The first hour of a baby's life will determine how they adapt to their new environment, and skin-to-skin contact helps regulate their temperature, breathing, and heart rate. While most of early research on skin-to-skin focus on the benefits of skin-to-skin care during the first 2 hours or 2 hours after birth, more recent studies show that skin-to-skin care boosts health well beyond the newborn's first days. Delaying bathing for at least 8 hours after birth protects the newborn skin from bacterial invasion, keeps the skin conditioned, keeps their blood sugar stable, since bathing might lower the temperature and often causing the baby to cry, both of which can promote hypoglycemia. Delaying the first bath encourages the establishment of breastfeeding, along with the bonding that mothers get with being skin to skin with their newborn.